Hi, my name is Jasmina, and I'm a behavioral neuroscience major. I'm going to be talking about mental health and how it relates to how it's perceived globally and how it's usually treated globally and how it affects the community as a whole. So in America, for a little comparison, 1 in 4 people are diagnosed with a mental illness, and in South Africa, it's 1 in 3. However, in America, it's 50 to 60% that are receiving treatment, but in South Africa, only about 25% are going to receive that treatment. And the most common forms of mental illness is depression, anxiety, mood disorders, and substance abuse. And it was actually found that in South Africa, substance abuse is particularly high when it's compared to other countries. So in South Africa, there are about 22 mental hospitals, and there are about 3.8 beds for every 100,000 people, and only 1%, even less than 1%, are reserved for children and adolescents. And in one study of studying children and adolescents with PTSD, about 91% of children reported that they experienced a traumatic event, and 38% was severe enough to be considered PTSD. And their PTSD usually comes from abuse from their childhood. So one of the reasons for the lack of institutions in South Africa, and one of the more important reasons that people can't get psychological help that they need, is because of the health funding provided in South Africa. Only 4% is allocated to mental health facilities, so that leaves just about nothing for people to get help from, because more of the money is allocated for treatments for more prevalent diseases like TB, HIV, and AIDS. So as everyone mentioned already, South Africa is split up into 2 sectors. There's a public and a private sector, and the public sector has to care for about 80% of the population, and the private sector is usually reserved for people with middle to high income earners, and they usually receive all the nicer high-tech things. And that's also the reason why healthcare professionals usually move towards the private sector instead of the public sector, which then leaves the public with even less resources. And according to the human rights, the Universal Declaration of Human Rights, Article 25, it states that people should always receive medical care to live an adequate lifestyle. And with the public and private sector, that kind of discriminates people from getting the medical treatment they need. And mental health does fall under medical care, because it is very important for people to receive treatment, because it can take a very serious toll on a person's life. And things like severe depression can often lead to suicide. So people need that treatment to overcome these. There are often many stigmas with mental illness, and it's seen globally. In America, it's often seen that some people don't take mental illnesses as seriously, and they think it's something that a person can overcome through willpower. So it's kind of like telling a person with OCD, like, oh, just stop obsessing, but it doesn't work that way. It's something that needs to be treated, and it's something that needs an outside help rather than just a person telling themselves to stop. In Africa, in African cultures, it's actually common for people to simply not believe in mental illness. So people they won't come forward and ask for help with their mental illnesses because they live in fear of being ostracized from their communities, and they think that'll be even worse than actually getting help. So to wrap it up, just spreading awareness about mental illness, it is a real thing, and it's something that should be taken very seriously. It's not something that it's not something that should be ignored, because it can lead to various serious matters and it also affects the people around the person suffering with a mental illness. And it, in turn, kind of contributes to society, because if a person is suffering with a mental illness and they can't get better, they in turn can't contribute anything to society, and therefore their community can't move forward when too many people are having depression and anxiety.